Hi, everyone. I'm Maggie McGrath, editor of Forbes Women. Menopause has become one of the most interesting areas of women health startups. Investors are awakening to the financial opportunity as women are demanding more from their doctors and their care. Within this space is Joanna Strober. She is the founder and CEO of Midi Health, a women's health company that she started in 2021 and now sits on the Forbes list of the next billion-dollar startups. Joanna, thanks so much for being here.
Thank you.
So, take us back to the early days of MIDI. You have prior healthcare experience in your business life, but why start a company that in the earliest days was really focused on menopause?
So it really was a personal experience for me. I was in my late 40s and experiencing a lot of issues of perimenopause, and I had a really hard time getting care. Essentially, I was having all of the symptoms, the hot flashes, the anxiety, the mood swings, painful sex. But because I was still menstruating, I kept on being told I was not in menopause and none of these things were treatable. And so eventually I found a private doctor that I had to pay $1,500 to and drive an hour. And in, in 1 hour, she gave me all the right medications. And within 2 weeks, I was back to my old self. And it just became really clear to me that all women deserved access to this type of care. And it shouldn't just be something from concierge doctors. And at the same time, I was working at a digital health company. And I had learned that the laws were changing because of COVID, so we could now make all women have access to this type of care covered by insurance. So that was really the basis of it, is understanding there was this huge opportunity to fill this gap of care and to create an expert care company that would be actually covered by insurance.
What's so interesting to me about menopause is you can look at other areas of women's health, and there are certain things that affect some of us, but not everyone. Not everyone has allergies. Not everyone will have heart disease. Not everyone will choose to have children. But if you live long enough and you have female body parts, you will go through menopause.
Right.
And yet, there's a gap in doctor knowledge. Can you talk about the training? I mean, it sounds like it really took a lot to find one doctor who was trained in this area to give you the care that you needed. How many doctors are menopause certified?
Yeah, less than 1,000 in the United States. So this all stems back to this 2001 Women's Healthcare Initiative, which looked as though the study initially demonstrated that it looked as though hormones caused breast cancer. The whole world panicked. Like, when you talk to doctors, they actually remember reading this study. And the study was wrong. The outcome now, 20 years later, they've actually learned that the women who were taking estrogen only were actually having a 30% reduction in breast cancer. So we have a study out there that is 100% wrong, that has convinced women nationwide that taking hormones is dangerous and will give them breast cancer, even though that's not true. And you had doctors in medical school for the past 25 years learning that. So we had this huge misinformation gap. And many people think this is one of the worst abuses of, you know, women's health in the last, 50 years, is the fact that this study got so wrong. So basically, we just have a lack of education because people got scared for something that was misconstrued.
I was going to ask about the change in the landscape because since you founded MIDI, it's kind of corresponded with this burst of public attention on menopause. You have celebrities shouting the words from the steps of the US Capitol. I get served ads on Instagram or influencers on Instagram who are talking about it, and I do not think that was the case even 2016, 2015. So is that because of a reassessment of that study, or what else is at play here?
So I think there are a few things at play. First of all, younger women are getting to experience perimenopause symptoms and getting pretty angry about it, right? They're realizing that these symptoms are derailing them both at their home and at work. And they're really frustrated that they're not getting taken care of. So that is also correlating to the fact that also we have this study is really getting looked at again after 20 years, and people are realizing how wrong the initial interpretation was. And they're looking at this data and saying, wow, actually, um, estrogen is actually breast protective. Women can take estrogen even if they have a family history of breast cancer. Women do, even if they have a higher risk of breast cancer, they can take breast like estrogen. Like all this data is now being looked at all these 20 years later, and we're realizing how wrong it was. But it is that confluence of women wanting better care and looking at the study.
We're used to so much information on other things, and as you age, you get to this life stage where it's like, "Wait a second, why don't we have answers here?" Which is again, it goes back to the early days of your company. So talk to us about building it. What was your you have that light bulb moment. You realize there's a business idea there. What was the hardest part about getting Midi from that idea to where we sit right now, which is on the next billion-dollar startups list?
Yay. So here's what we did. It's actually really fun. We started with 2 doctors and 150 patients. And we recruited these women from around California because we were only licensed in California. And we said, we're going to give you 3 months of care. And we're going to monitor every interaction that we have with you and our doctors. And we're going to give you medications and we're going to give you supplements and we're going to give you lifestyle advice. And we're going to just communicate with you a lot. And we'll give this all to you for free for 3 months. And then we're going to see how you do. And we got feedback the whole route. And then we said, okay, it's over. Now we're going to go evaluate. And they panicked. And they literally, I mean, of the 150, like 140 of them emailed and said, no, you can't go away because I don't have any place else to go to get this care. And that's really when we knew we had something, is being able to offer something that people were literally panicking if we were going to take it away from them. So now we're taking care of 12,000 women a week.
1,000
And
women.
we have nationwide coverage of insurance. We're hiring a lot of an army essentially of nurse practitioners to provide this care. We've also extended a lot of the different types of care that we provide. We very much started as a hormone company doing menopause. That was our basis. And now we're expanding much more than that because what we're finding is women will come to us because they're not sleeping. And then they come back because they want to talk about painful sex. And then they want to come back because actually they also have prediabetes and they want us to get those blood tests for them. So essentially, what we find is that there's such an enormous care gap in this country that once someone comes to us and they trust us, then they want to come back to us to get all of their care. And so that's really part of how we're expanding is that people come back realizing, oh, you can take care of my thyroid problem, or oh, you can take care of my migraine. And we are expanding the different types of care concerns that we attempt to take care of.
So you're starting to take a more holistic approach.
Right.
I think that makes sense because the body is integrated. And yes, there are specialists, but there are some times when I wish my own doctors were talking to each other. You go to the dermatologist because you have some eczema. Can we tell it's spring? I'm going to reference allergies again, right? And then you go to the allergist,
Yes.
and is the derm talking to the allergist? But does MIDI bring all of those pieces together?
Yeah. So the way we do that is we essentially create these care protocols. So we went out to experts around the world and created care protocols for everything. And we could basically, take from 5 different doctors for any one type of symptom, right? Take thyroid, for example, or take lack of sleep, for example. We got all the different protocols that include medications, supplements, lifestyle for every one of them. And then when people come to us for new types of care, we create more protocols. So essentially, we keep on creating our protocols and honestly iterating our protocols. We keep on scouring the world for what are the new things that are coming out? Is there a new drug? Is there a new supplement that can take care of these issues? And then we add that to the protocol.
That's interesting. You say supplements, and that can be the wild, wild west of medicine. How do you assess what supplements MIDI is offering?
So there is actually very good evidence for some supplements. There really is. Like magnesium is something that absolutely can help women sleep. We have a cortisol manager that we recommend, that's a combination of ashwagandha and L-theanine, and it works. There is really good evidence behind it. There's actually evidence that lavender can be a very good substitute for anxiety medications. So we look at the research and we pay really close attention to the research. We're not recommending things that are not with some efficacy, and then we make sure that we recommend brands that have high quality.
You mentioned nationwide, and at the Forbes Women's Summit in September, you talked about, 50 states. There can be 50 different insurance rules within
Yeah.
those states. So, how hard has it been to get to nationwide, and what was the trick to getting insurers on board?
Many of our efforts go to getting insurance and contracts, and we have to do that state by state. It is not. There's only 3 national insurance companies, so everything else is local. So you have to basically go state by state and get insurance contracts in each state, and it's a very long, arduous process that we have become good at maneuvering within.
Has there been, a key argument that you've used in conversations with these insurers or maybe a data point that they did not realize that as you have said, then they've said, "Oh, yes, we get it now"?
So the average woman goes to 6 of the wrong types of visits before she gets the right care. So if you look at that, if we can avoid all of those unnecessary visits and start with the right care, we can reduce costs immediately. And then the other thing is, like, the average primary care doctor refers 35% of their patients to a specialist because they don't have all of the expertise and they don't have access to this huge number of protocols, right? So now with our patients, we only refer 4% of them to specialists because we're able to take care of a really much larger group of symptoms. And then what we're doing is we're connecting with healthcare systems around the country so that if someone needs in person care, we can get them efficiently into that health system. So, for example, in New York City, we're partnering with Mount Sinai. We have a relationship with them. So, if you are a MIDI patient and you need in person care, we can get you in faster.
So getting the insurance companies on board is one lever to growth for you and for Midi. The other big one is investors. Can you talk about the conversations you've had with Silicon Valley and perhaps how the tenor of those conversations have changed from 2021?
Yes. So when we first started, convincing investors that menopause was a hot topic was not easy, honestly. It was not an it was a complicated discussion. Like, why aren't women just getting this from their primary care doctors? Why aren't they getting it from OBGYNs? Is there really a market opportunity for this? So the first funding was hard, and I'm incredibly grateful to those early investors who took a bet on us, when we really had nothing more than a PowerPoint and this pilot that showed that women really wanted this care. Now the fundraising has changed because we're able to show so much traction. So we're just on a very fast growth trajectory. We're probably the fastest growing telehealth company ever. Quite honestly, we are showing extensive repeat patients so that it's not a one off. They come back to us over and over again, and we're showing they're actually staying with us for years. So, we really are taking a part of their healthcare spend and becoming an integral part of their healthcare lives. So, the fundraising has been much easier now that we're able to show that it's not about women's health, it's just about being a good business.
In September or in the fall, you announced a special purpose vehicle that had some celebrities on the cap table. And you and I have talked about the difference between physician advocacy versus celebrity advocacy. How did that SPV in particular help MIDI?
The press loves writing about celebrities. The truth is that celebrities have a unique way of breaking through the noise that most other people cannot do. So there are online celebrities, influencers that are very powerful. There are different women who are high profile who are able to break through, but that ability to break through is hard in today's world. And celebrities have a unique way of doing that. And so we're really grateful to those who are willing to give us their money, but also their name and their support, and honestly also become our patients. So um, Amy Schumer put out a video a few weeks ago on being our patient and how grateful she was to Midi about the care that we are providing to her. And that was very valuable to us. So, not, and she said, I'm an investor in this company and I invested because I believe in it and because I'm a patient. And, the news picks that up and they love writing about celebrities. And so it is a good way of breaking through the noise.
What's interesting to hear you talk about MIDI is you use the term healthcare company, holistic health, more than you use just even women's health or menopause health. Can you talk about how you see MIDI potentially as a play on longevity medicine?
So it's funny, longevity medicine is actually preventive care. And it is a much better branding than preventive care. But what is longevity? Longevity is taking care of your bones, taking care of your brain, taking care of your heart, making sure that you're eating appropriately, making sure that you're getting the right screenings. Are you getting your cancer screenings? Are you getting your mammogram? Are you getting your colonoscopies? That is actually women's longevity. So, what we have found is that for many women in their 40s, for example, they don't know if they are in perimenopause. They do know they want to be healthy grandmothers. And they know that they would like to take care of their bodies so they can see their children grow up and have children. And so what we have learned is that there is a very tight confluence of perimenopause, longevity, which is essentially primary care, and then menopause, which is for women who are a bit older. It's actually really important that you start the preventative measures before menopause. So we don't want to wait until we're 65, for example, to take care of our bones. If you wait until 65 to get a DEXA scan and you find out that you have osteoporosis, it is too late to do something. In your 40s, you can start getting some scans. You can start seeing how your bones are doing, and you can start taking medication if appropriate to keep your bones strong or lifting weights to keep your bones strong. So, what we have learned is that you can't really tie these things apart. It really is about prevention and making sure you're doing the things that can keep you healthy and not just treating the symptoms when you're not feeling well.
That's interesting. Now, in September, you talked to us about a piece of legislation in Washington, D.C. around telehealth. And you mentioned that in the earliest days of MIDI, telehealth regulations because of COVID really helped you grow. So, what is the status of that legislation and general telehealth access in the United States right now?
So, it's a bit precarious. There are a lot of questions about exactly what government will continue supporting in terms of insurance covered telehealth. I do believe that will continue. The bill that I was lobbying for, that I spent a lot of time lobbying for, was regarding the DEA and enabling controlled substance to be prescribed online rather than having to go in person to have controlled substances. And the controlled substances include ADHD medication, they include sleep medications, they include testosterone, which is a essential part of women's hormone treatment, particularly for low libido. And, I was and actually remain concerned that if you require people to go online excuse me, if you require people to go in person to get this care, they won't get the appropriate care. So the extension happened for a year in December, and so it'll come up again this December. So I've been talking to a lot of senators and congressmen about this. The good news is this is not a partisan issue per se because there are many people who represent rural healthcare areas, for example, who do understand that you don't want to take online prescribing away because it really is taking access of care, access to care away from people. So I'm cautiously optimistic that the law will stay as it is right now and not go backwards. But there's a lot of open issues that need to be managed.
Bipartisan is probably the magic word these days. How much of your time as CEO, as founder, are you spending or do you need to spend on the lobbying front versus talking to investors versus talking to patients? Is it like a third, a third, a third, or does it depend on the week?
No, I would say it depends on the week. I went through a very intensive lobbying time in the fall when I realized there was a chance that we would no longer be able to prescribe these essential medications. I went on a tear to DC and spent a lot of time trying to talk to people in the government about this. And then the extension got passed, so we have a little bit of a calm before we'll have to start doing this again. And then investors, honestly, it's the same thing. You go for a fundraising round, and then you kinda get a break until and then you get to go back and focus on the company and your patients.
What else has changed since we spoke in September? What are the new offerings? I know you mentioned 12,000 patients a week, but what are the other big developments since you've read the Forbes Women Summit and also since the Next Billion-Dollar Startup list came out?
So, I mean, I think since the last billion-dollar startup list came out, we've actually doubled in size. So,
Proving our
we're
thesis.
yes, we are growing really fast. It is exciting to watch how fast we are growing and to realize how many people need this care and how many people are interested in getting the type of care that we're offering. We are developing actually our own line of some skincare products that are exciting. So we found, for example, that there's a need for estriol face cream. So estrogen, we know, is a really good it basically, as you age, your skin gets thinner in part because of a lack of estrogen. And so if actually there's an estriol fit face cream that we actually created for your face that helps thicken the epidermis and makes it less likely to get wrinkles, So we created that. We actually created a vaginal cream that is particularly attractive to women, and then we're creating additional products as well. So we're understanding what the women's needs are, and we're creating products in order to solve those needs.
Creating them in-house with your own formulas versus licensing others or prescribing out, I guess?
That's right. We're using compounding pharmacies to actually make the products that we realize are appropriate.
Is that your big focus for 2025, or what else do you have going on right now?
So first and foremost, we're always going to be a service company, right? The products are always going to be second. The most important thing I do is provide really high quality care to women. So we are creating more care protocols, and essentially we're creating care protocols in response to the reasons why women are coming to us. We're seeing more women coming to us with mental health issues, and so we've been expanding our mental health issues and adapting more screening, for example, for depression and anxiety on the onboarding so that we're able to refer women to the right place if they have needs that are in excess of what we are able to offer them. We are, expanding more of our understanding of GLP-1s and making sure that whether it's compounded or whether it's not compounded, that's not the issue for us. Making sure that you get access to the right GLP-1 that's appropriate for you if you want to lose weight. We're also exploring, honestly, GLP-1s microdosing for longevity. I think that as the longevity work comes in, we are seeing that combination of hormones and GLP-1s are the two components for women for longevity. And so we are going to be looking carefully at prescribing hormones and GLP-1s, not just for symptom treatment, but for your brain and your bones and your heart.
What are the impediments to growth that you see right now? It's an uncertain economic environment, it's uncertain political environment. That's kind of broad. What specifically in Midi's world could be a limiting factor?
You know, that is a really interesting question because we do think about it all the time. The nice thing right now for us is that we are only taking commercial insurance. So we don't have to worry about Medicaid or Medicare changes. If I had to worry about that, it would be much more complicated. I don't believe that insurance is going to stop paying for our care. So for us, it's actually operations, quite honestly. It's hiring the right number of NPs, training them, making sure they're really talented, making sure their quality of care does not go down as we scale. That's probably what I think most about. We have a 95% CSAT right now. I want to continue that and make sure that as we have thousands of providers taking care of women, that we are offering the same quality care that we are offering now. And then, honestly, using AI to figure out how to scale better. There's a lot that we can do with technology to ensure high quality, whether that's using the AI to review the charts, whether we use it to do the trainings. We're never going to have AI do the care per se, but there are a lot of very exciting opportunities to use AI to make sure that our care is higher quality. And so we're spending a lot of time looking at that.
Well, I wonder if there's a discovery factor there because I feel like there was just a big story from a Forbes competitor about how AI was used to diagnose a rare disease. So if you have patients coming to you with confounding symptoms, could AI potentially, I don't know what type you're using, could it connect the dots and say, this is this person's disease or issue, and these are the treatments?
So what I'm hoping in the next year is you're going to see a MIDI AI, and we're calling it MIDI Pal. And basically, I think I mentioned we have protocols. They're like this, right? We have massive amounts of protocols. We will basically put all of that into our own AI, and then the NP will be able to type in a question and see where someone would come out. Well, and then we don't have to worry about hallucinating, right? Because the biggest problem with AI right now is the hallucinations. And so you can't trust the AI because of those hallucinations where it makes things up. But if we make it just on our protocols, then the NP will be able to quickly go in and type, here's this person has a high risk of cancer. Her mother had cancer. She has a risk factor for BRCA, but she's interested in hormones. And it will immediately tell them what the possibilities are.
You have a lot on the horizon. Is there anything we missed in your final 30 seconds here? Anything else you would share with the Forbes audience about what you have on your plate?
No, it's really exciting. I'm actually incredibly excited that women can get access to this type of care, and I think that everyone does deserve access. So I think eventually we have to offer this for men. We have a lot of men calling and saying, "I want access." Once in a while, my wife says that I should come to you as well. So I do think that eventually we will offer a MIDI for men, and not just give women access to our high quality care.
Comprehensive healthcare. Joanna Strober, thank you so much for sitting down with Forbes. We so appreciate it.
Thank you.